Welcome back to Carolina Beat, everyone. I'm over here with Dr. Norma Cortez from CapeFearSmiles, and we're talking all about laser dentistry and how far this industry has come for not only the dentist, but also the patient. Welcome to the show, my friend.
Hi, how are you?
I'm fantastic. All right, let's talk a little bit about laser dentistry. What is it?
It is a new way of doing dentistry. You pretty much use a beam of laser to remove tissue, and it has so many good advantages. The procedures are more comfortable for the patient.
Right.
It's still a new way of doing dentistry than the regular drill.
Really?
Yes.
So what treatments can you have done with laser dentistry?
It depends on the actual beam and source. For example, you can do gum tissue surgeries, you can do whitening. Nowadays, everybody wants to have a brighter smile.
We love a brighter smile.
Yes. You can even do some drilling and cavities.
With
restoration.
a laser?
Yes, and it also depends on the source of the laser.
Okay.
Yes.
So how does it actually work?
So we work with Waterlace. It's a biolace company, and they use an erbium chromium YSGG beam, and it just removes the cavity and the enamel, and it takes a little longer, but it's totally worth it, especially if you want to have no-shot dentistry, no shots, and or minimal shots.
Okay, so when you're doing it, just sort of explain that procedure. Let's just say we're talking about gum disease. How does that process work? Because normally when we deal with gum disease, we're dealing with deep cleaning.
Yes. Correct.
Does this help with gum disease?
It does help eliminate some of the bacterial source. Usually if you have a very compromised periodontal disease, then after the regular deep cleaning, you will need probably surgery.
Okay.
Laser dentistry will be instead of having a scalpel. So the recovery is better. Anything that the laser beam touches, it will kill bacteria, and the recovery will be faster because it also promotes healing.
Perfect. So that's what I wanted to ask you is, what is the best solution for it? Why laser?
If you want to have a more comfortable experience, it's also a minimally invasive way of doing dentistry.
But there's no pain? There must be some pain.
You're going to have the normal post-operative treatment, right? Yeah. But you should not. But it will make it heal faster, and the recovery should be better. Okay. But yes, you're going to have the regular post-operative.
All right. Well, we do have to ask, what are the disadvantages? There must be something.
Yes, nothing is perfect, right? Ideally, if no one has a cavity or periodontal disease, that will be ideal. But yes, a couple of disadvantages. The procedure might take a little longer. Okay. Because you're not numbing the patient. You need to go through some settings. For example, when it comes to cavities, you need to go through some settings to make the patient comfortable.
I got
you.
So
it takes a little longer. What else?
But is it still covered by insurance?
Yes.
So can I phone you and say, I want to have the laser today instead of my normal dental procedure?
Yes, and also another disadvantage that you just remind me, thank you, is you cannot do every single procedure in dentistry. You cannot extract teeth. I wish I could pulverize those babies, but no. You cannot do crowns, for example.
I understand. Well, we're going to get into more detail with what it is that you do over your dental service. If you want to find out more information, there it all is up on the screen for you. CapeFearSmiles and General and Cosmetic Dentistry, Dr. Norma Cortez. We'll be back after this short break, everyone.